Liberia Business Association, LIBA Liberia, and LIBA USA support Liberia own business.
First of all, thank you very much for the opportunity. I'm Ms. Yassah Lavelah. I am a registered nurse in Liberia, and I am also a 2014 Maternal Washington Fellow. And this is not my first time to the United States. As a matter of fact, this is my third visit here. In 2014, I was here to participate in the Maternal Washington Fellowship, a flagship program by President Barack Obama at the time. And then I left, I went back to Liberia. In 2016, I came here to actually lobby for my work that I do back home. And then 2017, I'm back here again to continue what I started in 2016. So this time, I'm here again to lobby for another project back home, building a maternity center for women and children in the Painesville area. And it's a pleasure meeting the LIBA family. Once again, thank you very much for the opportunity.
My understanding is that you currently are running a clinic. Tell us a little about your clinic.
Okay. This clinic was founded in 2008 as a mother-daughter partnership. After I watched my mother doing deliveries in our homes when I was a kid. So in 2005, when I started school in Cottington as a nurse, I decided to introduce to my mother the idea of building a community health center. Instead of just doing deliveries in our home, we could build a clinic in the community that will help a lot of women and children. And she actually bought the idea, and we got to work with the help of the community and some goodwill ambassadors. We were able to build a 5-bedroom clinic, which we currently operate in the Painesville-Gorbachev area.
My understanding is that during the Ebola crisis, your clinic played a very important role in that community. Could you tell us a little about the difficulties you went through with a small clinic servicing a large population?
Yeah, it was actually difficult for us during the Ebola crisis because operating as a private facility, we never had the materials we needed to serve the community at the time during the Ebola crisis. We were out of personal protective materials which we needed at the time during the Ebola crisis. And as a matter of fact, my mother got exposed 2 times because she did a delivery for one Ebola patient, and she never knew, and she never had the personal protective material, and she got exposed. But with the help of Notre Dame and hospital sisters here in the United States, we were able to get a container full of medical equipment. It was difficult though from the initial stage, but when we got these equipment, we were able to work with our traditional birth attendants also in that community, because at the time, hospitals were closed and traditional birth attendants were the only ones doing deliveries in the community, as well as our 5-bedroom clinic. So it was a challenge for us, but we could not sit by and watch women die only because we cannot afford these materials. So at one point in time, we had to use the ring gear. We had to use plastic as gloves until help finally came when Notre Dame and hospital sisters decided to send us some materials.
And my understanding is that the Painesville area has a population of over 200,000, and your community is almost serving, your clinic is in a place where you have over at least 38,000 people. With 5-bedroom clinic, I can see the need for your project. So tell me, how was it with you? My understanding is you were in the United States at a program or undergoing some training when the Ebola hit and you went back home.
Yeah, that point in my life, usually when I talk to people about it, I said it was a breaking point for me, because in 2014 when I came to the United States, it was my first visit to the United States, And then when I came on the Mandela Washington Fellowship Program, I left here until August. The program actually ended in August. But then the Ebola crisis intensified back home after my mother got exposed the first time. And then I sat and said to myself, what am I doing here? America needs me, but Liberia needs me most at this time. So I decided to go back. Family and friends actually thought I was being foolish. And then they were asking me, why are you going? Are you sure you know what you want to do? I said, yes, I know exactly what I'm doing. So I decided to go back. And then when I went back in Liberia, I had to charter a taxi at the time from the airport because no family member could pick me up at the time. So I got back and immediately I got to work. So I was working with Doctors Without Borders, MSF, and at the same time working with Yassah Lavelah Hospital. So at the time, my small clinic was operating, but we could not operate up to that standard because we were lack of materials. So we were just operating on a low scale until we got the materials. But it was a challenge to leave the United States at that time when I was offered a temporary stay here for a year. It was something that was difficult to do, but I took the courage and did it because people back home needed me, family and friends needed me, and I could not just sit back and watch. My heart was I was in the United States, but my heart was in Liberia. So I took the courage, I went back, and I worked until Ebola was finally eradicated from.
One of the things that LIBA is looking into, and we're doing feasibility studies, is to start an insurance company in the diaspora, wherein people will pay for their family members to have some health care in Liberia. But talk about the community you live in. Most people do not have jobs, but yet everybody gets sick. Sanitation is poor. So tell me, how is your clinic dealing with people who come to the clinic and don't have money to pay, but you have to deal with them?
Yeah, and that is one of the severe problems we face, but we're kind of trying to cope with it. With the help of the Ministry of Health in Liberia, we try to treat patients that cannot afford, and this is how we do it. So patients come at the clinic and then we send them to the lab. Once their results are out, we talk to them. It's like your results, we already have your results, but you don't have the cash. So this is what we do. We're going to start your treatment, and then before you can complete the treatment, whatever you have, you can bring it. Some patients pay us in goods, some pay us in kind, and some don't just pay us at all. Like for the deliveries we do, sometimes we do the deliveries, we provide food, we provide clothes for the patients, and then they don't pay us. But it's something difficult to do, but with the help of other partners, like the U.S. Embassy been helping us a whole lot, the Ministry of Health been really helping us. But it's not just enough, because they're not always doing it. At one point in time, they will do it, and another time they won't. So it's a serious challenge for us, and this is why I'm here today to lobby, because if we have more support and more help, we can serve more women, we serve more children.
Correct.
In that area.
And again, you're watching LIBA TV. One of the things that during the interview, we did invite you to speak to our business-to-business meeting, and you did a really good job in your presentation. One of the things that I've told our members is that we all travel to Liberia. Some of us own businesses down there, and we could be in the Painesville area, have an accident, and we will need treatment. So I think it's a good thing to support your initiative.
Yeah.
Tell me about, do you have a pharmacy within your clinic?
Yes, we do have a pharmacy, but it's a very small pharmacy that don't even have a storage room. So we had to cut a partition in that small room to store our drugs there. So we don't even have an air condition there to keep our drugs cool. We use fan because we cannot afford the cost for electricity to run the air condition. So we actually need some help with improving the pharmacy, but we do have one, something that we can manage.
So if people watching you will say, if you're going through all of these difficulties, If you're going through all of these, why even do that?
One thing I always let people know is that passion has been the key word for whatever I do. Because sometimes people ask me, how much do you get paid? And then when I call my salary to them, or how much I get paid, or how much I'm even paying one of my staff, they're like, are you serious? You joking? But one thing is, passion is the key word here. Every time I sit, I'm like, I think I have to leave this job. And then I sit and watch women dying, watch children dying right before me, and I know I can do something to help. And then I will always talk to myself and say, Yassah, you got to do more. You need to do more. So passion been driving me all along to do this.
My understanding is that you've been offered a scholarship at the Harvard University, but you need some more forms of assistance to follow up your education. And I believe this would be good for Liberia, because with your passion, you'll be able to go back to Liberia.
I was recommended by a friend to Harvard, and they asked me to apply based on my work, what I've been doing back home, my experiences doing Ebola crisis, and in the health care area. They asked me to apply, and when I applied, I was selected, and in December I was admitted to Harvard. But then Harvard could not afford the entire tuition, so they asked me to defer my admission by 1 year, which will be next year, July. So I need to raise a total amount of $65,000 to help me to start up the process. So once I'm in, then the rest, Harvard can take care of the rest. But I know this is going to be something, it's not something easy, but I know I can better serve Liberia in a bigger capacity once I go to Harvard and complete my 2-year study in global health. I can serve my people in a bigger capacity, not just being limited as a nurse. So this would be like a dream come true for me, and this is why I'm asking everyone who got a heart to help Liberia to see reasons in supporting this scholarship thing. Whatever it is that you can afford is going to help.
Well, again, LIBA, the Liberian Business Association, we are looking at all the different avenues in which we, Liberians who own businesses in the diaspora, can contribute to the growth and development of our country. And so one of the things that that concern us the most is the health care, and that's why we are putting some time into working with you and talking to you to understand what it is. We also have a member of the Liberian Business Association, Clarence Doyle and his wife and family, that are building a hospital. But that hospital will be in going to the Mavee area, okay, which is definitely needed for that environment. Sure. But let's just go back to healthcare. Okay. Mothers, we do have people who are having babies in their homes. How do you collect data? How do you have that information? Is there a computer system? How do you share information with clinics? How is the information system protected? How are people's information protected? Could you throw some light on that?
This is a serious challenge when it comes to protecting patients' information, patient privacy. But we've been trying our best to see how we can actually protect our patients' privacy and their information. As a matter of fact, we don't have computers in our clinic. I have just one laptop that I use for my work, and we also use that laptop for everything, right? So our monthly report that we send to the Ministry of Health is on a hard copy. We actually do it on a hard copy and send it to the Ministry of Health and keep our own copies. So how we collect information from our traditional perfect tenants we work with is this. We do have a ledger that we distribute to each of those traditional perfect tenants, and then we assign a volunteer from the community with those traditional perfect tenants, because not all of them can read and write.
Correct.
So those volunteers work with them. For example, if a traditional perfect tenant did one delivery in the community, she needs to call her volunteer. Her volunteer will help her document that delivery. If there was complication, if she did a referral, she needs to let her know, where she did a referral. So just in case of a maternal death, we can trace that mother and see how it happened, whether she did her referral on time, whether she did what she needed to do, and everything. So with that ledger, we have a monthly meeting every second Tuesday. We collect the ledger from each of them, go through the ledger, and see what was done at the time. Because right now in Liberia, we have an increase in maternal mortality, which is like 1,072 women dying per 100,000 live births. So you can just, figure out exactly what that is. Because I read some time ago that in the United States, just 28 women dying per 100,000 live births. And if you have 1,072 women dying per 100,000 live births, that's a disaster.
Correct.
So that's the reason we are working with our traditional birth attendants and encouraging them to do referrals instead of doing deliveries home, because in case of complications, they don't know how to manage these things. And we don't have this referral system where you will call an ambulance like this and it arrives. No. Sometimes we have to use a motorcycle for referral.
So a woman is pregnant and she's on a motorcycle?
Definitely. Sometimes they have to walk 1 hour, 10 minutes, 2 hours from a village before they can reach to the nearby health facility. So it's a serious challenge for us, but we're trying our best. The Ministry of Health is also doing well, trying to see how best. It's not easy because in Liberia we have bar road networks. It's not easy to get to these villages, but gradually we will get there.
Okay. And so your new project, your proposed project. Tell us about your proposed project, the facility, your new facility you're projecting, or you hope to build. Tell us a little about that facility.
Okay, that facility is going to be a 20-bedroom clinic, and then we're going to have another building on the side just for maternal issues, like deliveries, antenatal visits. Everything about maternal issues will be done in that building, and then the bigger building will be for pediatrics, the children, and we have some short stay there. We're going to have a well-equipped laboratory, and we're going to have a well-equipped pharmacy. We will have a cafeteria in there where maybe our patients don't have to go out for food, and we will also have like a conference room, because we also want to do it like where we can call our traditional birth attendants and skilled birth attendants together, and then exchange ideas. So we have a conference room in that building where we can always have these meetings.
Sure. So in conclusion, talk to America, talk to Liberian businesses, talk to Liberian in the diaspora. Let us know what you want from us. What do you want us to do?
Okay, thank you very much. So let me just take this time to speak to whoever is going to be watching this, to speak to your conscience. This is about Liberia. This is not about me. It's not about anyone. It's about Liberia. Today or tomorrow, okay, you might say, I'm not going back to Liberia, so I don't really care. But one way or the other, you have someone in Liberia. You have a friend, you have a family, you have a loved one in Liberia, one way or the other. Once you're from Liberia, you're connected to people some way or the other. There's a need to help. There is a need to help. We cannot just sit and watch our mothers die. We cannot sit and watch children die from diseases that they can be treated for. Like diseases like malaria, like anemia. These are things that we can prevent and we can also treat. So with the little that you can afford to give, it's going to help. The total project budget is $175,000. Fine. Somebody might say that's just a pocket change for me, but back home, that's a lot. And we can achieve a lot with just that $175,000. So today I'm here to speak to you. Do whatever you can, and let's have this facility built. That today or tomorrow you can sit and say, I donated $5, but my $5 benefited thousands and thousands of women. So whatever you can do, whatever it is that your heart is telling you to do, go ahead and do it. And God is going to bless you. God is going to pay you back. You might not get your pay directly, but somewhere or the other you will get paid. If one woman delivers today or one child life is saved, that life could be a life that will benefit you, your family, or someone today or tomorrow. So thank you very much once again, LIBA. It's a pleasure, and I will always love to have this kind of conversation with you.
Thank you. And thank you for being here.
Thank you.